Good afternoon, my name is Hannah and I'm going to be doing a presentation on my clinical practice at the UK Children's Hospital. In my clinical setting, I have endomyosynthesis at the UK Children's Hospital on the 4 East side. All of the patients that I see are pretty much general pediatrics, so I'll see anything from a patient that has been having seizures or seizure activity, anyone that has any kind of constipation going on, urinary issues, and sometimes I've also seen quite a few actually of ostomy care. With the age range, it's pretty wide. From my clinical experience, I have seen infants from a few days old all the way up to 16, 17 years old. So on this floor, it's pretty general as far as the types of patients as well as the age. So for my paper, I talked about adolescents with suicidal ideation. And from this and my clinical experience, I've seen a lot of this recently, as well as whenever I was in my pediatrics class before. And I just think it's so important to talk about this just because of how prevalent it's become. Whenever I have been in, I've seen so many patients come in with SI next to their name. And with these patients, it's so important for us to understand exactly what they're going through and how we can really approach it and give them the most optimal care possible. So suicidal ideation, let's start with pretty much the broad term of what it is. It covers any kind of acts, wishes, thoughts, or attempts of any kind of anything from self-harm all the way up to an actual suicide attempt. And from this, suicide is actually known to be the second leading cause of death in adolescents, and that's the range of 10 years old all the way up to 14 years. And in this, it's prompted by a lot of feelings of unworthiness, low self-esteem, loneliness, or if they've experienced anything from bullying, and also some possible trauma that they've been going through. And with that, we are looking at a lot of multiple factors that are attributing the fact that they are thinking about suicide or even just causing self-harm to themselves. So it's really important that we really dig deep into this topic and figure out what exactly is going on and how we can approach it better. So I think the first thing that's super important is to look at these cues that we're going to see. And again, being able to recognize them early, quickly, and be able to get them treated faster. So the first thing we want to look at are behavioral traits. So these traits can be perfectionism, hopelessness, impaired decision making, depression, and these can be coming from school if they're really trying hard in school, but they just really decide that they want to try to be perfect in everything and they're frustrated with themselves with it. If they're just feeling hopeless and think that nothing's going to work out for them, or if their friends or parents or family members are noticing that they have impaired decision making and they're kind of rash in their decision making. And going back to what I said about stress, so the stress related to childhood trauma. So this could be from events that have occurred in the family as far as maybe a divorce, also maybe, bullying from their family members, losses in the family, or maybe even a rape if it really gets to that deep of an issue. So it's really important to understand that they're going through a lot right now and they really need our help as well as our training to be able to figure out the best treatment for them. So along with these cues, they're going to do some physical acts possibly on themselves. These are, self-harm, drug use, tobacco use, alcohol, distancing from social groups or activities, isolation from their families, and also early sexual exploration. So within these cues, it's really important to prioritize them. And coming from a nursing standpoint, it's really important to look at the actual physical health issues first. And in that, talking about self-harm. And self-harm, you can see it in bruising. They will hit themselves. They'll hit their heads against a wall, possibly. You also see cutting. A lot of the times it's either on the legs or the arms. And then the second part of the prioritization are the psychological. And so these are the mental issues such as depression, anxiety, isolation, and a lot of these contribute to the act of self-harm. So within this, hypothetically, if adolescents have an admission diagnosis of SI, if they receive dialectical behavior therapy or DBT, as well as have an increase in nursing staff, there would be a decrease in admissions of adolescents with the diagnosis of SI, as well as less episodes of SI. And the solutions to this, one, obviously, is the DBT, and two is increase in nursing staff. And so we're going to talk about what DBT actually is with this short video.
Dialectical behavior therapy, or DBT, is an evidence-based treatment that addresses people's ideas about themselves, their world, their emotional pain, and how they cope with feeling upset. DBT has been shown to be an effective way to help people understand and experience their painful thoughts and feelings while finding less dangerous ways to cope. This means they can change some of the ways they think and feel about what they've been through. DBT includes participation in group therapy, individual therapy, and medication management. It can be intense, but since it's usually used when people are hurting themselves or thinking of suicide, a team approach to treatment can really help them. It's often a very caring, supportive environment for people who haven't always felt cared for. DBT is a structured program, and some DBT groups even hold a graduation at the end of treatment. This can be an important moment for young people who often have a long history of starts and stops in school, work, and relationships.
When talking about DBT, like the video said, this is a very supportive type of therapy, and I think it's super important to really talk about this with adolescents, especially at their age and what they're really going through with that identity. And so with DBT, what it really is it's utilized and designed to help them with kind of their mental outlook on their issues that they're facing, and really playing on mindfulness to change their thinking process instead of doing the self-harm. Maybe there are different ways that they can cope with the stress or the anxiety or the depression or isolation. And in doing so and changing their mindset on these things, then that's going to change the behaviors of that individual. And going back to talking about the analysis of cues, with this DBT, what it's going to do is, after we look at first the physical harm that they have done to themselves, then in turn, we can then talk to them about DBT, creating that trusting environment. Because as a nurse, you really want to make sure that that adolescent feels like that they're being taken care of. Like the video said, a lot of these people that are going through this really don't feel like they are taken care of or that they're cared for. So it's super important for a nurse to be able to realize this is going on and understand what they're going through and be able to create that trusting environment just by taking care of them, making sure they're okay, and fixing the physical aspects of what they've done first, and then really creating that trusting relationship with them to then introduce the DBT option to them. And then after that, we would have multiple check-ins to make sure that they're doing okay, and we could see the effectiveness of the treatment with, the number of times that they have tried to attempt suicide or some type of self-harm, as well as if they have had any other thoughts. So in DBT, there was a study done by Burke and his other researchers, and in this study, they found that 74% of the adolescents that they had in this study that were acting in self-harm showed a decrease in the self-harm episodes within 3 months of starting the DBT. And on top of that, now we're going to get into increasing the nursing staff. And with, like I said, with the trusting environment, it's super important so that the nurses are able to create that relationship and have that time to. Because if they're short-staffed and they're constantly having to go around to different rooms and they don't have enough time to create that relationship, then DBT really isn't going to be as effective as it could be. And it really can't be introduced to them as effectively as it could be as well. In saying that, Reen, along with his other researchers, they found that an increase in the nursing staff compared to times when it was depleted, that the self-harm cases in the adolescents they were taking care of decreased. This was seen whenever there was a shift change. So nurses were obviously distracted and there weren't as many being able to look out for these these adolescents. And in doing so, and increasing that staff, they were able to decrease those self-harm cases because they were trying to harm themselves or even attempt suicides while these nurses were unable to be attending to them. So in conclusion, I have seen a lot of adolescents being admitted to the hospital for SI, any type of attempt, self-harm, or just any kind of thought that they had that they wanted to either self-harm themselves or attempt suicide. Understanding the cues of this and being able to really recognize what's going on is of utmost importance in nursing. Just being able to talk to them about treatments, as well as understanding the prioritization of the cues, going back to making sure that we talk about the self-harm aspect of it first, healing those wounds, because you have to heal the physical ones before you can heal the inner wounds that they have from all of this stuff going on in their lives. And so it's important to really talk to them after you treat those physical wounds, to talk about that therapy to be able to heal them from the inside out, not just the outside. And finally, also being able to increase the nursing staff, being able to create that trusting environment, being able to help them and guide them in that decision making in that process, especially if they're not comfortable with their own family members in this process, is of utmost importance as well, for us to be able to give them the optimal care that we can as a nursing staff. Thank you.